a couple of the strategies that I think often are really helpful for many of our teenagers, or if they've got anxiety about appointments or procedures, making a plan as a family. How far ahead of time do you want to know? How much information do you want to know? And how do you want to communicate that? So just working with your teenager and your family ahead of time to kind of tailor the amount of information they want and give them kind of background.
If you are the parent of a teen or tween, it is very likely that somewhere along your parenting journey, you have faced some sort of a medical challenge with your child, whether that is just fear or stress over getting a shot or a dentist visit, or if it is something more significant like a trip to the ER or managing a chronic medical condition. Medical care and fear around that can show up on a wide spectrum, from just a little bit of mild stress or avoidance all the way to something genuinely traumatic. And today we have an expert here with us to talk to us about how to recognize it, how to prevent it, and how to support your family through even a longer medical journey. So we are welcoming Dr. Meghan Marsac, who is a pediatric psychologist and the division chief of psychology at the University of Kentucky Pediatrics Department. When I say she is an expert, I mean it. She has published more than 75 academic articles and 10 book chapters on pediatric medical trauma, so she knows what she's talking about. She's also a creator of the Selly Coping Kit and an author with Melissa Hogan of an incredible book, Afraid of the Doctor: Every Parent's Guide to Preventing and Managing Medical Trauma. This is an incredibly well-written and easy read, actually, for parents, really broken down into very manageable chapters with solid evidence-based information and things that are actionable for parents to do. So we are so thrilled, Dr. Marsac, that you took the time to be with us today. Welcome to the Parenting Pair Podcast.
Oh, thank you. I'm so excited to be here and to talk with you all about your experiences and share my experiences over time in supporting kids through all kinds of medical stuff. Like you said, it could just be like a vaccine shot, or it could be some like really serious medical condition. So I'm very excited to be here.
Well, that's why we thought this would be such a great topic, right? Because I think so many of us have had this experience, right? With our kids, whether it's something smaller or something more significant. And what's really interesting to us, right, is that you are a psychologist and yet working kind of in this larger medical system and hospital. And so we wondered, maybe to start with, of why you wrote this book with your co-author, and kind of what was the impetus or what motivated you to do that?
Yeah, a couple of things I think brought it to life. One is my amazing co-author, Melissa Hogan. She is a parent of a kiddo with a really serious chronic medical condition. And so I think she had walked the path and walked the life, and she had really dug in to try to figure out what is there for parents. And she had shared with me early on when we had just met, it felt like a part-time job trying to figure out how to support her child through all the different medical treatments. And then for me professionally, I have gotten to work with kids and families going through all kinds of different medical things. And one thing that always stood out to me is, we're not trained as parents to guide our kids through these hard medical things. And, being a parent outside of a medical setting is hard enough. We don't have a manual. We need a manual just to be a parent. All the little intricacies. I'm a mom myself. So, every day can be an adventure. But then when you go into the medical system, and it could be something as little as a shot from our perspective. That's not that big a deal, right? Or the nasal swabs, during COVID time period, all the nasal swabs. Man, oh man, those were hard for our kids. And so thinking about in our teens, broadly, and some of our adults as well. And so just thinking about what are the things that we've learned over time from kind of learning from our families that we can share back with parents to give them and equip them with the power to, even if you don't have access to a psychologist, or maybe you don't really need mental health care, but what can you do as a parent to help your kid through any kind of medical challenge?
I think that's so important in so many areas, but you highlighted when you were just speaking about, we really do bring our judgments and our experiences to what happens to our children, right? So if we think the COVID swab is not a big deal, we might inadvertently invalidate, a child who's really quite, nervous about it. And then on the further end of the spectrum, if there's a very significant, medical event going on or medical trauma going on, our own emotions can get in the way of our ability to think through what the next step is. So I can see really paying attention to that, and why I think your book can be so grounding for people. Where I'd like to sort of start, as psychologists, the three of us here, you write about the connection between medical events and medical illnesses or trauma and emotional and behavioral struggles in kids, teens, etc. Can you speak a little bit about that?
Sure. I think one of the things that I love that we're seeing in our society is that we're shifting a bit from thinking about mental health and health separately. So in past times, doctors would be like, oh, that's in your head, go see a psychologist. Or um, thinking about like what's the medical diagnosis versus the mental health diagnosis. But as we've kind of learned more, we know like there's so many health outcomes that are linked to mental health and behavioral and behaviors that we engage in as well. And then sometimes we know like if we have physical health challenges, it affects our mental health. And if we have mental health challenges, it affects our physical health. So I think really bringing it together and making our mental health and our emotional health care part of our teenagers' path, integrating it. A lot of places are starting to make mental health care available at the pediatrician's office. You might notice that a lot of places are the doctors are asking questions about mental health, about anxiety, about depression, like all these different things. And so there's this movement that I'm very, very pleased about that's helping with some of that stigma of like mental health means there's something wrong with you. Mental health is just it's part of our health. We're all people. We all have different struggles at different times. And so really bringing that together, it can help our overall health be better for our kids and ourselves.
Yeah. And you're absolutely right. Any sort of health concern or medical, issue that comes up can be a significant stressor for people, which could lead to, or even just at a simpler level, if I'm sick, I don't feel well. And when I don't feel well, then I'm tired and I'm cranky and I probably isolate more and I probably act, more like kind of someone who might be feeling a little with low mood or, with a mild depression because I feel sick. They are so intertwined.
Yeah, well, and I think of teens and how much they have to do and how much they have going on as well.
Mm-hmm.
And just even something, not even a chronic medical condition, but getting a bad cold or getting the flu or COVID. And that even after they, physically improve and the physical symptoms have remitted, how much stress or how kind of despondent or distress, they can be because they've fallen out of some stuff or they've gotten behind and they can feel a little bit like hopeless or overwhelmed by it. So
Sure.
And I talk with them a lot about like, that makes sense. Like you just missed a couple of days of school. But sometimes I think it's like, oh, you're better now. Like we kind of forget that there are these other behavioral or kind of emotional components to our physical illness.
Yeah, I think those are just wonderful points because I think sometimes as adults, we forget like when we don't feel well, how do we really function? It does hit us too. And then thinking about our kids, it's like during the illness and then after, like what's that recovery looking like for kiddos? And some of our kids have chronic things or intermittent things that like comes and goes and they're trying to like integrate that into teenage life. And what does that look like? And so really paying attention to like how are our teens doing navigating that is really important.
Yeah. As you're talking about integration, it's making me think about something that I read in your book that I highlighted because I really liked it, where you wrote about considering medical challenges in the context of a child's whole life and not separately. And I would love to hear you speak a little bit more about why you and Melissa made that point.
Yeah. So in some of like the kids and families that I've had the privilege of working with, sometimes you'll see where, especially if there's chronic things going on, it becomes all about that medical condition, like the medications, the doctor's appointments, the identity of our kids shift to be, we'll give an example like cystic fibrosis, like I am my cystic fibrosis versus I am, we'll say Suzanne, and I'm an amazing human and I have cystic fibrosis and I have to do these things to manage cystic fibrosis. And sometimes as a medical team too, we can kind of forget about all the other pieces and parts of everyone. But there's things that we can do and things that parents can advocate for. For example, things like certain appointment days or times. We can't always make it convenient for us 100%. But if there's a flexibility coming in the morning or the evening and you have to miss your favorite class, can you have flexibility around that? Some of the families we've worked with medical teams as well to say, hey, like this medication dosing is preventing the child from a certain activity or the teen from a certain activity. Is there any way to, while still taking care of the physical health, can we optimize the way you dose the medication so that they can still do their fun things, like the good things in life that they're looking forward to? So thinking about like all those things, like the social parts of the child, the family, the parts of the family, like all those pieces when we're thinking about how to care for our kids' health.
And I think that's probably helpful to parents who at times, depending upon the condition, may be very stressed out themselves. And so, having, providers, psychologists, physicians being thoughtful about that can be helpful, because I think parents get very overwhelmed and scared. And we have to make this better, or I have to get the treatment for, CF just right. And, we have to go to the hospital at this time, And
I think a lot of times, no fault to medical providers and doctors, but they have busy schedules. And particularly if you have a child who has needs that maybe you need specialists, I know what that is like. And I've had clients sit in my office where they put their phone out and they'll say, I'm so sorry, I'm waiting for a call from the doctor. And you know that once they call and they give you whatever appointment, you have to take it. Right. And so I think there is this feeling sometimes of, we've got to get what we can get for our kids. And so if they tell you to bring your teenager there at 6 a.m., which is a nightmare time for teenagers, or they tell you to be there at 5, but being at 5 means they have to miss play practice. And that's right. I think, so it's an interesting point between helping parents with that, but also I imagine that's where you come in working in a hospital system of providing that information to medical teams too, of being thoughtful about that.
Yeah. And there are definitely times where 100% you got to take the appointment. It's the only one. They're the specialist. You've finally gotten in. You got to do it. But especially if you've got chronic things going on, or even things like when we think about vaccines or blood work for needle sticks. So some of our teens, I think a lot of times our expectations as parents and sometimes as medical teams are, by the time you're a teenager, you should be able to tolerate your needle sticks. But for some of our kids and teens, and again, even adults, it's still very, very, very scary. Like the body has processed it in a way that it really spikes their anxiety up. So even in some of those appointments, thinking about, does my teen do better first thing in the morning, get it out of the way so they're not thinking about it all day? Or they are bare in the morning. That is a terrible time to go get like routine blood work done. Let's schedule it later in the day. And then sometimes if you've got kids that are working ongoing with specialists, you can have a little more flexibility in scheduling. And there are times we just got to all deal with it, and it is what it is, and we're going to get through it as a family. And, there's some of that in there too, of course.
But I would imagine that seems so respectful, though, even thinking about it, right? And being able to communicate to a team, whether that's a medical provider or a parent, of, I know it's so hard for you to do this later in the afternoon, or you have to miss this, and this is the only time, but we're really sorry that you have to miss this,
right?
This thing, right? There's a lot of respect in that, and an acknowledgement of what you were saying, that this young person isn't just this illness. Like, they are a person that has many things going on in their lives. And unfortunately, sometimes in life, one thing takes precedent over another. But we can still acknowledge that those other things are really important, or that we're going to try at other times to avoid that.
I love that. I think one of the strongest things that we can do is validate our teenagers and our tweens, validate their feelings of like, I really wish we didn't have to miss your play practice. I really wish that we're not going to mess up your whole school day by having this appointment this time. We're stuck with this. I'm going to do everything I can, but just validating that, I get what you're saying. Yeah, that's a real bummer. And we're stuck with it this time. But just that validation that helps that connection versus we're just doing it. You have to go. It's too bad, so sad. Which all of us have probably said at some point, something along those lines, because we're not perfect as parents either. But if you're looking for ways to try to support your teens and your tweens through these kinds of events, just like that suggestion is beautiful. It's just to take a moment to validate how they're feeling.
You're really highlighting how, the parent-child or parent-teen relationship can be so impacted by a medical event, a medical trauma, or a chronic illness, or just having to get a shot if you're very, frightened of that notion. And in your book, you talk about sort of the role of a parent as sort of a parent versus a caregiver, and you make that distinction. Can you talk a little bit about that and why that's important?
Yeah. So especially when you've got chronic illnesses going on, but it can even happen if you've got like some short term, like a big injury and you're doing extra caretaking. So you shift from like your general parenting role where you are kind of connecting with your child as a parent and the kind of your standard, the things that you want to be having that relationship. And you have all this extra stuff that you have to get done. And you shift over to this, we've got to get this medication in, we've got to get this appointment done, so it puts all this extra pressure on parents to be able to get all of this done and to be able to kind of puts them into like more of a caregiver role. And it takes away sometimes from that relationship.
Yeah.
Yeah, I would think, and you provided some excellent examples of this in the book, particularly in those tween and teen years, I think is where that hit me, right? Where very often, families have maybe transitioned where teens and tweens are driving themselves somewhere or setting up their own schedule or making their own food or showering by themselves, or any of the number of things that we bathed our kids when they were little, we're not bathing our 14-year-old. And so we've moved on from that. And sometimes with an injury or some sort of significant illness, right? Mm-hmm. We have to take this step back to almost caretaking them in a lot of ways, maybe like they were a much smaller child or really taking away unintentional, right? Some of that autonomy, right? No, you can't drive yourself somewhere because your foot's in a boot and that doesn't work right now. And that's particularly hard because if everyone has transitioned out of that and if teens are strongly desiring it, and to be quite honest, as parents, the idea of going back and having to put a bath time routine into my evening right now makes me want to melt under this table just thinking about it with the exhaustion. I think that's such a hard thing for families to adjust to, whether that's temporary or maybe for those families where long-term, that's what it's going to look like, where a parent might be in a caretaker role for a young adult or adult ultimately.
Yeah. And I think those examples are beautiful, right? And it's hard, I think, keeping in mind the whole family system. So it affects both the teenager or the tween as they've started to get their independence and like, just kidding, we're going to take some of that back now if, they can't do certain things. And then we also have it from the parenting role of like, we're celebrating. I don't have to fold your clothes anymore. Maybe, you're on your own for getting dressed. You're on your own for showering. Oh, they can finally get themselves to the 25 practices that they have to go to. So it can be hard for everybody. And then sometimes, and one thing that I think I want to make sure that we touch on is thinking about siblings also, because sometimes you have a sibling that is not having the same kind of medical challenges. And if it's, this new medical challenge pops up for a family, the attention shifts potentially. Mom or dad or grandma or grandpa, whoever is caring, may not be able to like spend as much time with the sibling. And, so there's also, it's not just, the parent and the teen that's going through it. It can also affect the whole family system. So something to kind of keep an eye out for as well.
Mm-hmm. In those situations, do you recommend that parents kind of acknowledge that to a sibling, or like what would you say to a family, right? Because it may be that functionally there are some things they can't change, right? Like mom or dad does have to leave early now in the morning to take the other child to regular doctor's visits, or they have to start dinner for themselves in the evening, or grandma or grandpa's going to spend weekends there and parents are going to be gone, so sometimes there are maybe things that are harder to change because that's a family's new reality. What do you recommend?
Mm-hmm. So I think there's a couple of things. Acknowledging is beautiful. Like I'm a big fan of open conversations. We don't have to give our kids every single detail of every little thing, depending on how old they are. But you can talk through of like, yeah, this is different. This is our new normal. Let's figure out like, what can we do for you? And like, listen. I think a lot of times just carving out that time to listen, and some things we've suggested over time, and I think we comment on this in the book too, is creating a check-in time with siblings. So it could be once a week even, like at, Thursday at 6 p.m. If you're in a medical appointment, you might have to move it that day. If you're in the hospital, you can do it Zoom style. You can get creative with just to do a check-in and just listen to what they have going on in their life. Because the other thing that sometimes happens is we end up unintentionally as parents getting disconnected from siblings. And sometimes siblings, you have kind of a couple different ways it goes. Some siblings don't want to bother you as a parent with anything. They're like, it's so hard. They're trying to protect you as a parent. And so we do see that a lot, especially in our teenage siblings, where they're trying to protect their parent. And so they're keeping all their own stuff to themselves. And so just having those check-in moments and like just being very clear, I want to hear about you. How are you? This is hard, and setting those on. Other times our siblings are a little more obvious in their distress and they act out. And so if you see the acting out, recognizing that as like, could this be part of what's going on in our family with the other thing? And then again, walking through it and getting support for that sibling if they need it as well.
I really like the setting a time, a meeting, a check-in, because I know it's overwhelming for so many parents, if there's sort of a sudden onset of a new or just coming to become aware of a medical condition of some type. There's a learning curve, there's so much worry, so much pressure. And so really making that explicit. So it's like, okay, because I think parents have a lot of stress and they're keeping so many things in mind. And then, oh no, I didn't check in on, Susie or Joe and just making that clear so the child knows or the teen knows and the parents. I really like that because there's a lot to track and do. Mm-hmm. And I think that brings me to a point that you bring up in the book that I think could be overwhelming, but you're just putting words to what parents experience anyway, that in ways that the parent is kind of the leader of the medical team. And I think when a parent could read that, they might, dear God, like, am I not doing enough already?
Yeah. Now I have to go back to med school.
I mean, please, Could you speak to that a little bit, what you meant by that and how to understand that concept?
Sure. Yeah. Even me listening to you say out loud, I'm like, oh, it's a lot. It's a lot. But I think a lot of our parents are doing it already. They haven't, but I think wrapping your head around what does that mean and owning that you're taking that on, I think, and giving yourself credit. If you are scheduling all the medical appointments, sharing with one doctor, well, this doctor actually said this, how does that fit with what you're saying? Advocating for your child to get their medication, dealing with insurance companies, managing, you're probably already doing it. And we do see some parents take it on in different ways. Like some parents are all in and they're also Googling and trying to learn everything that they can know about their medical condition, which, we can talk about that at some point too. But I think there is that, it's like that responsibility as a parent, but also it can be really hard because if you're somebody who doesn't like to speak up and question the doc or question the nurses, it can be really, really challenging for parents. But we know medical teams are really complex. And as parents, we can't assume that every doc has read every note or knows what all the other teams, especially if it's a complex situation. And so I think it does end up putting a lot of pressure on our parents to take that on and try to bring it together and communicate with the team, on behalf of their child and teen. I think for teens and children, we can also equip them and have them start practicing. So some things we do, some of our teens are they're on it. They're I'm going to ask the doc my questions, and others are a lot more quiet and more reserved. But one of the things we often encourage parents to partner with their teens and their tweens to either get their questions ahead of time and ask them for them if they're not ready, or to have them write down your list and then to defer also so the teen and the tween start to get to advocate and they get to be part of that lead with you. Because as older they get in the teenagers' years, the better you're going to be in empowering them and equipping them with the skills to take over the leadership of their medical team too. So then you're not all on your own either as a parent. Then you got a partner. Yeah.
And it does sound like a very daunting thing. When I read it in the book, I was a little woo. But having had some experience in medical situations, you are right that there is a reality to it too. And I think it can come as quite a shock sometimes when you realize that medical systems are complex and not everyone communicates or things are understood differently by different nurses or other people that come on staff, which is why then I think I found it was very helpful to me reading about your coach approach and what that acronym meant and kind of guidelines for okay, this sounds daunting. Here's how you can think about it. And here's what this would look like. So I'd love for you to explain that to parents.
Yeah. So we created like the coach as an acronym of a way to kind of break down specific situations that you're having a challenge with. And the C in the coach is collecting information. So that could be if you're working, let's say you're taking your child for blood work. So a more simple one, but your child's kind of gets really, kind of escalated and really challenged with that. Finding out like what is the flexibility with the blood work, who's going to do it, what is the setting, observing. Sometimes you can even go in and take a look at the space ahead of time, depending on the way the clinics are set up. Asking the question, is this a necessary blood work or is this voluntary? And then making sure for you as a parent, ahead of time, are we doing this today or are we going to try to do this today, which are totally different approaches then, right? With somebody who's really, really anxious. And then figuring out, I went on to the observe and the ask. So the coach, I went on rambling with the observe and the ask. I didn't even say what we were doing with there. So for the coach, it's collect info, observe the situation. So kind of look at what what are all the challenges in the situation. Ask all the questions. That's the A. The other C is choose your strategy, and the H is help your child. So as you kind of walk through that, you're collecting info, you're observing, asking all the questions. And then thinking about what strategies do you think will work best for your teen or your tween, and like thinking of them ahead of time. And so that's, a proactive way. And then you help your child through it. And we also created it such that that's like a circular thing. So let's say it doesn't go well. Then you're going to look again. You're going to like, okay, let me get some more information. Maybe I need support from a mental health therapist if this is like really big reactions. Maybe I need to ask my doctor, a different approach next time. So that you can continue to apply that strategy kind of over and over again, where you kind of work through this process and kind of break it down to make it a little bit less overwhelming. This applies for like chronic situations too, but that was like, just kind of picking out one piece of the challenge.
Yeah. What I hear in that, that I just would like to emphasize, because I think it's so important, is just the ask part. I think so often parents can feel intimidated by medical professionals or by a situation, or maybe overwhelmed, or maybe just even being in medical environments. For some people, that in and of itself can feel scary and overwhelming. But just really, if you're listening to this today, if you're going through something, if, your child's about to have surgery and you're unsure about something, call and ask. Our medical professionals are here to help us, but they don't always say exactly what we need unless we let them know what we need. And I think it's just so important, even if it feels, if it's uncomfortable for you to do that, or that's not naturally your typical way of being, that you have every right to call up, ask the questions, get the information. And sometimes they're questions that have been asked so many times as a handout, but you just have to ask it.
Mm-hmm. Yeah, and there were so many great ideas that you had in the book. I'm remembering one, I'm not sure if it's totally accurate, but if your child's in the hospital, kind of using that wipe erase board that the nurses use to kind of write questions up. So it's like right there on the board. So if it's harder for you to maybe communicate, whether there's language barriers or just your own confidence level, or, so it's kind of there when a nurse or someone walks in and they might see it, I thought was a great idea.
Yeah. Or some of our parents, we found that really helps, especially because different teams rotate through too if you're in the hospital. And so sometimes you might get different answers from different team members. And so if you want multiple perspectives, or you want to ensure that you're sharing the answers back, sometimes we also suggest you write the answer or have the medical provider write their answer on the board. So if a new team member comes in, if they have a different answer, we'd be like, well, you need to go talk to Dr. Smith because Dr. Smith actually said that. So could you guys, huddle and figure out how does this overlap with your different specialties? And so that can be really helpful. And sometimes parents find it really helpful also to just write down their questions too. Even handing the notebook, if you're real nervous, be like, I wrote these down, but like, it's too hard to ask them. You can even write them down and hand them a notebook and say, here's the questions we came up with. Or you can like read them off of your notes. Because I can't tell you how many times I've worked with a parent be like, yeah, I got flustered in the appointment. I forgot to ask that. And I've been that way myself, where I've been like, oh shoot, there was my 12 questions and I asked 3 of them. Nuts. So sometimes also that can help you stay focused too and make sure you get the answers you need.
Yeah. You offered in the book a lot of really excellent, and obviously we can't talk through all of them today, but a lot of really excellent ideas on how to kind of prevent maybe or cope ahead, in the spirit of kind of helping kids if there's potential medical anxiety or medical trauma. Are there a few that you might want to share with parents listening today?
Oh, goodness. There's so many ideas.
I wrote down, I know what I wrote to you. I was like, there's so many ideas. Here's 15 of them that I loved. Can you speak to those? So we'll just pick a few and then we will refer everyone back to your book to get further ideas if this speaks to you. But, if there are a few that you think maybe some families find particularly helpful.
So one thing I will just say kind of broadly is that different strategies work for different kids. And you know your child better than any professional is going to know your child. And so really thinking about pick the things that you think fit for your family. And if there's ideas that people are telling you that you're like, that's not going to work, let that one go. So just really tailoring it for your child. A couple of the strategies that I think often are really helpful for many of our teenagers are kind of planning ahead, understanding the why. So giving them the information ahead of time. So if they have to get blood work, what is it looking at? Why is it important? Like, not that, oh no, we just want to give you a bunch of needle sticks because we're mean, but what is that going to tell them? How is that helping them stay healthy? So understanding kind of a why, understanding ahead of time, working out with your child, if they've got anxiety about appointments or procedures, making a plan as a family. How far ahead of time do you want to know? Because, some of our teens don't want to know 3 weeks in advance and don't want reminded, and sometimes parents are like, don't forget, you've got this coming up. Don't forget, we're going to do this on Tuesday. Some of our teens are like, just tell me that morning. It's fine. Others are like, don't you dare tell me that morning because I need 3 weeks to prep myself. And so figuring out with your family, making like a plan ahead of time, how much information do you want to know and how do you want to communicate that? Does it go on the calendar? Does it go on a whiteboard? Do I tell you out loud? So just working with your teenager and your family ahead of time to kind of tailor the amount of information they want and give them kind of background. So I think that's one that can be really helpful.
I really like that because kids are so different even within families. I mean, just in parenting, the way you might approach an issue with one, child or teen in your home may be entirely different than another one would. So it
might be different than how you would prefer it. Because I was just thinking of like, oh yeah, I like to know all these things in advance, and that might not work.
And one of mine would not. Yeah. Interesting.
Yeah, I've had that on my own experience with that as a parent because I'm an information seeker. I'm like, give it to me all. I want to know everything. And I've got one kiddo that's like, I don't need to know all that. Like, just tell me, like, where am I showing up? What am I doing? Like, just like they don't need the background of it. And so that's a beautiful reflection of like how we think as parents might not be, how our kids think. And it is different. Like I think about my kiddos, they're different. They would not pick the same strategies. They would not do it the same way. So having those early, like having that communication with your kiddos, I think is really, really helpful as you go into any kind of medical appointment at all. So that's one that I think is universally really helpful.
I agree.
That's great. Thank you.
Yeah. I could take this. Where were you going,
No,
Suzanne?
go for it.
No, I was just going to jump over to, I can imagine, we've covered, we could stay talking on this topic for, 2 more hours. If there are parents listening right now think, oh, I didn't think to do this, or I don't check in with my child about that, or I feel afraid to ask questions, or that whiteboard idea is really important and my child has regular check-ins for her CF at the hospital or whatever it is. If they think I didn't do any of this, did I do it wrong, or am I not helping my child enough, or what if I missed something? What would you say to that?
I think that working through medical things with your kids is just like anything else. Like as a parent, every day we're learning new things. Like, ooh, I wish I didn't do potty training that way. Oh, I should have given him more vegetables. Oh, if I would have done it this way, this would. So it's just like anything else that we're trying to do to navigate as parents is we do the best that we can with the information we have when we have it. And if you learn more and you're like, ooh, maybe that would help, you add it in. And if you're like, we also all make mistakes. Like, I don't know any parent that has never once yelled at their child. Maybe they're out there. I'm guilty myself of getting frustrated in moments. So, we make mistakes, right? And I think owning that for ourselves, like, oh, I think I can do this better. And focusing on what can I do as we move along and not what did I do 3 years ago? You just take the days and the moments as you can and you just do your best as a parent.
And as someone, I too like a lot of information. If you are a parent listening and you're feeling at a stuck point or you need more guidance, reading a book like this is really helpful because it can be relieving to think, oh, there's another way to go about this, or maybe I have more agency than I think I do. So that can be really helpful. But you're absolutely right. When you were going through all the ways that we parents change over time or learn more things, I thought every one of those mistakes, that could be like a book. Like, oh, I didn't feed them enough vegetables. I didn't, take them to the dentist twice a year. I forgot to, whatever it is.
Right. And some of those things that can create so much like guilt or shame or deep regret for parents, right? And some, I would imagine, around medical things or things potentially that might be chronic and ongoing or trauma, right? How distressing this can be for parents sometimes to look back and and these things can happen, right? Like there's an accident or someone suddenly gets ill, right? You're not prepared for this, all of the struggles. So I imagine a lot of parents can look back very easily and think, I would have done this 17 different ways, if I'd known, or if I'd known my child was going to become afraid of strep throat tests, I would have done the coping ahead for the first one, but I didn't know that until it happened. So I love that. And I actually really love that we're kind of wrapping up here in this point talking about parents, because we requested, and Dr. Marsac kindly obliged us to do another episode because this is really only kind of half, and we're only tackling just a little bit of all the advice and expertise she provided in the book. But this is only half the equation. When kids are struggling with anything related to medical, or they've experienced some sort of medical incident or trauma or chronic illness, we focused on kind of the experience in many ways of the adolescent. We are going to have her back to do another episode on the emotional impact on parents and ways that they can help and support themselves or get help from others when they're coping with ongoing medical struggles or medical journey, or any of the things that we talked about today. So we hope that you will join us again for that, because we think it's going to be really excellent and kind of tackle a different angle on this topic.
Absolutely. So we'd like to thank you for today, of course, and tease, look out for another episode that we're going to be doing. And we'd like to speak directly to our listeners. If you and your family, or if you know someone, a friend, a neighbor, who has a child or has a teenager that's struggling with a, chronic medical concern or some sort of other medical event that's been difficult, please pass this episode on, because there's certainly Dr. Marsac's book is available, and Melissa Hogan's book is available, Afraid of the Doctor, as a resource. But share this podcast, because I think there's a lot that can be comforting about the possibilities that exist when you feel really overwhelmed, you or your teenager. Yeah. All right. So with that, have a great week.
And now a quick word from our lawyers. The Parenting Pair podcast is designed for informational and educational purposes only. Do not rely on the information presented in this podcast as a substitute or replacement for professional psychological or medical advice, diagnosis, or treatment. If you have concerns about you or a family member's well-being, please contact a licensed mental health professional or physician.